Well, hi again, everyone, and welcome into Health Talk Mississippi, brought to you by the Mississippi State Department of Health. I'm your host, Greg Flinn, and in this podcast, our goal is to entertain, inform, and educate you just a little bit. And this month, we're going to be talking about maternal mental health awareness. One of the top priorities for the state health officer, Dr. Dan Edney, at the Mississippi State Department of Health is infant and maternal health. Critical to the success of whatever goes on here in Mississippi. And mental health many times is more important, if not equally as important, as physical health. And we're going to talk about that today with a powerhouse panel of guests. First, we have Ms. Jillian Harper. She is our director of the Healthy Moms and Healthy Babies program. You wear so many hats over there. It's just hard for me to kind of keep it all.
Yes, I do, but glad to be here today.
Now, excellent. And then we have LeJeune Johnson, who is a board member for the Postpartum Support International Mississippi chapter, who is here with us today. Thank you.
Yes, I'm here. I'm really glad that we've created some space today to talk about this very important issue.
Very good. And then Dr. Thomas Recore from the Mississippi State Department of Mental Health, and you are their medical director over there. We've had you on the podcast before, so we thank you for coming in to talk about what I think is a very important issue.
Thank you. It's good to see you again, Greg.
Well, I guess I'll start, and I'm just going to throw this out there for you guys. We'll start maybe with Jillian. Jillian, you work so closely with moms out there. What is the main issue when we talk about maternal mental health?
When we think about maternal mental health, well, there are several issues, but the main thing, of course, is making sure that mom is healthy. And we talk about, again, the physical health, but also the mental health is important as well, to make sure that mom's going to her doctor's appointments, that she has a healthy baby, that she's able to communicate well with her child, as well as being able to bond. So it all works together in regards to mental health and that physical health.
Well, we're getting folks on board with it because May is Maternal Mental Health Awareness Month, and the governor was kind enough to help us proclaim this month to kind of bring some more attention and spotlight on it. June, it really is something that I don't think a lot of people have talked about a lot in the past.
Sure, absolutely. And, to Jillian's point, we really have to take in consideration mom's physical health and her emotional health. And it's something that we all should be really invested in, because the health of our moms is foundational to the health of families, foundational to the health of, thriving communities and society. The fact of the matter is about 1 in 5 moms will be diagnosed with a perinatal mental health condition, whether in pregnancy or in the postpartum period. And so creating these spaces where we're able to talk about these conditions help to kind of normalize the conversation around it, so we can increase awareness, increase access to resources, and increase connection amongst mothers.
Dr. Tom, you're used to dealing with mental health issues over there at the Department of Mental Health. For you, there's all kinds of folks that need to be caring for their mental health. What sets moms apart?
Yeah, I think popular media would have new moms believe that the arrival of a baby is only a time for joy and not a major life change. Your life changes structurally. Any new parent that has hobbies has seen those hobbies disappear in some ways, and it's really hard. It's really hard to lose sleep. For moms especially, it's really hard on their body, what happens with their hormones, regardless of how the delivery goes. Expectations of society, all of that is, I think, what's particularly challenging for young moms, for new moms, pardon that.
Well, June, it's one of those things, again, people, Dr. Tom said, it's a happy time, it's a celebration time, everybody's up, but for everybody on a daily basis, it's hard to be up,
Sure.
all day.
Yeah.
What do you see with some of those moms out there?
Well, to Dr. Recore's point, this is a major life transition for moms, right? And with that life transition comes, like we was saying about the hormonal changes, right? And those are things that can increase a mom's likelihood to be diagnosed with a perinatal mental health condition. Those hormonal changes, sleep deprivation, lack of support, and then also if you are going into the pregnancy with a mental health condition, that also increases your risk for encountering some challenges during pregnancy or in the postpartum period as well. So it really takes us, and for a lot of moms, like if I'm experiencing some challenges during this pregnancy, I can feel a lot of guilt and shame and feel some stigma about having those experiences, although most moms are having those experiences, but we don't feel safe to talk about those things. So that's another reason why we have to kind of continue to normalize these conversations so moms know that they are not alone and that there are other moms who have navigated these challenges as well. So I'm really glad that we're here, centering this topic.
I guess for any of you, what are some of the signs that people can look out for, friends and family, for a new mom or an expectant mom?
Of course, anxiety is one. If she's constantly worrying about the baby, and is the baby getting enough sleep? Is the baby going to stop breathing if I go out of the room? I can't give the baby to anybody else. I'm the only one that can take care of baby. Depression, so if they're not hanging around and doing some of the things that they used to do or enjoy, sticking to themselves a lot, crying most of the time. Now, we go through the baby blues those first couple of weeks, but if it starts to where it hasn't worn off yet, you're still crying, you're still anxious, you're still worried, and then just like LeJeune was saying, the guilt of why am I not happy that I just had this beautiful baby? Why am I not bonding with baby like I should? So just being on the outside of being a caregiver or a spouse or family member and seeing just those changes with mom, that she's of course we've had a major change, that hormonal change, a life change, but if she's just changed as far as being the person that she was before, you need to start looking at some things and talking to somebody about it.
Yeah, and I think, Dr. Tom, it's one of those that it's not always just hormones, is it?
No, I mean, Jillian brings up some great points here. I tend to categorize things. It's just how I'm built. And so I think about sort of low index of suspicion for wanting to get an intervention, and then sort of a moderate degree to which we need to get intervention, and then severe, right? Like when you're talking about symptoms folks need to look out for. And so it's totally normal for a mom to feel overwhelmed, totally normal for a mom to feel exhausted and tearful sometimes, totally normal and actually advisable for moms to ask for specific help, right? Mm-hmm. And then all of that's fine. And then sort of moderate, you start thinking about mom, really sleep is the foundation for what moms need. And so if someone is exhausted, they get an opportunity to sleep, the baby is looked out for, and they still can't sleep. Then that's something that, it's moderate. So going to see someone, the primary care doc, your OBGYN, that's a perfect time to do that. Starting to feel depressed more days than not, starting to feel hopeless, these sorts of things, it's better to get seen than not. And for all of these issues, intervention before a crisis is almost always more effective than waiting for a crisis to emerge. So you've got, on the lowest level, you've got the normal emotions that go along with being exhausted and overwhelmed and the hormones. And the moderate level, you've got things like sleep and feeling depressed. And then the severe level, really where you need emergency attention, we're talking 988, we're talking emergency room evaluation, are things like moms having thoughts of harming the baby, moms having thoughts of ending their own lives, and this sort of looking like a possible escape from the way they're feeling in the moment. Those call for emergency evaluation, and then there's also a rare condition in postpartum women. It's called psychosis. So postpartum psychosis is when moms are feeling paranoid, overwhelmed, hearing voices, sleep. In vulnerable populations, lack of sleep can precipitate that kind of psychosis. But when moms are so overwhelmed that what they're saying doesn't make sense, God is giving them commands to release the baby from this bodily form. All of those things are, in the forensic world, we see the terrible outcomes that come from that. And so those are all, those three I mentioned, thoughts of harm to self, thoughts of harming the baby, or psychosis, all warrant emergency evaluation and intervention.
I guess like anything else, though, when you have to have the personal responsibility to say, I ain't got this, right? It's like, I need help. And that's okay, isn't it?
It's so,
For sure.
It's okay, but due to society, social media, just the way life has been for years, is that this is what I'm supposed to be doing. I got this. This is what a mom is supposed to be doing. I have to take care of this. Yes, it's hard, but everybody else has to do it, so I have to do it too. So that mental thought process of, I can't complain, I can't cry about it, because this is the way it's supposed to be. So it's the stigma of that. It's hard to be able to ask for help, even though we say that the door is open for it. But just being there, support the family, the friends, the doctors, the nurses, doulas, everybody, just being a loving arms around them and saying, hey, we know you got this, but we're right here with you to support you. And Greg, I should have led with this, but maternal mental health is the leading cause of maternal death in the U.S. The leading cause, not in Mississippi, but it's in the top. But it's the leading cause of death in the U.S.
Never would have guessed that.
Right.
We think medical. When we think about pregnancy-related complications, we tend to think medical. But I did want to circle back around to Dr. Recore and Jillian's point about, reaching out for support. Dr. Recore mentioned postpartum psychosis. I think we've done in recent years a lot of great work around normalizing the conversation around postpartum depression, but we don't know that there's also, perinatal anxiety. There's also perinatal OCD. There's also perinatal PTSD. There's also postpartum psychosis. There are a lot of mental health conditions under the umbrella of perinatal mental health conditions that we haven't yet started to really dive deep into and talk about. And so when mom is experiencing emotional overwhelm and anxiety or intrusive thoughts, those things haven't been normalized, in social media or in conversations about maternal mental health. So mom may start to feel a lot of guilt and shame about having those conditions and may not feel empowered to talk about them for fear of, I'm not a good mom, I'm a bad mom. And so again, just us having these conversations and normalizing that, having a perinatal mental health condition can look different across the spectrum given a mother, any mother. Sometimes it looks like, like overwhelm, frequent crying, but then sometimes it looks like irritability, anger. Yeah. For many folks, you wouldn't know that this mom is suffering from a mental health condition or perinatal mental health condition because she's, she looks great on the outside, right? She's walking around, she's functioning, she's doing all the things, but internally she's struggling and doesn't feel safe and empowered to reach out for support.
And Greg, you mentioned asking for help, and sort of there are more and less effective ways to ask for help. And so in addition to the things my colleagues here have described, for new moms that want folks to help, they very often find people that say, if there's anything I can do for you, please let me know. And the moms go, well, for stigma or whatever reason, they're hesitant to ask for help. But permission for moms to be specific. So if you say, if there's anything I can do, please let me know. Yes, dinner Tuesday. If you can get it here by 5 p.m., I would really appreciate it. Or is there, boy, you look exhausted. If there's anything I can do to help, yes, Saturday at 1 p.m., I would like to take a nap. I'm going to turn golf on the TV. That makes me fall asleep. And you're going to hold my baby after I eat a big meal of chicken and whatever. So you get it. So being really specific early on, before crisis, to say, I know I'm short on sleep. I know this is really hard. and I love my baby. It can be really hard, and you can be a great mom and feel overwhelmed and ambivalent. All of these things can be true at the same time. So that's one of the things that I think is most helpful, is to offer to new moms, people that are offering to help you, make them put their money where their mouth is. Great. Thank you for the advice. Saturday at 1, we agree? So I think that's one of the effective ways for moms to be able to advocate for themselves, specifically to get their needs met.
Well, and I think it's incumbent upon dads as well. You know, I mean, that's the number one, your first line of defense when you need support should be dad, right?
Yep, and you know, there's literature now that is emerging that, again, we've all kind of said, like, maternal mental health conditions don't just affect moms, they affect the whole family. And now there's new literature coming out now that's showing that dads can also get, it's called paternal postpartum depression, by proxy of the mother. So about 1 in 10 dads are diagnosed with paternal postpartum depression. And so that just shows you how impactful the well-being and emotional and physical of our mothers is, because we know when mama's not doing well, typically the household isn't quite running like it's supposed to. You know, even when she's just, you know, sick from, you know, a cold or sick with the flu. So when we look at maternal mental health conditions, much more magnified. So again, you know, like, to your point, you know, dads are just as important in this conversation too. We need to center them too, because oftentimes they are the primary source of support for our moms.
Well, I can remember 13 years ago, you know, when my son was born, you know, I saw mom and I could tell she was kind of struggling a little bit. And, you know, I remember the sleepless nights as you're listening with one ear. It's like, what was that? Okay. So it really is, I like how you point out that dads can suffer from it too. But again, they have the best eyes because they're in the house more than anybody else, that they can really be the eyes and ears for that.
And one of the active roles they can take is, just like we're talking about friends that offer support, mama can say, or dad can say, baby wakes up twice in the night at 10 p.m. and 2 a.m. I'm going to take the first wake up feeding. I want you to take the second wake up. That way we both get some continuous sleep. Just ways of effectively communicating about how we make this house work. And both of us carry the burden can be incredibly effective.
Well, it goes back to support system, you know, whether it's dad or if there is no dad, you know, it's a single mom. It's that support system that's so critical, not only from family, but the extended, you know, your church family that everybody always wants to do something nice. And Dr. Tom, I think you brought it up well, that, hey, be specific about what are the things that you can provide, because you got a lot of older ladies in the church that have been there, done that, got the T-shirt, right?
Sure. But could we put an asterisk by that, like offering support, being intentional about offering support to families? That's so big. Because to Dr. Recore's point, like, you know, mamas think we can do it all, right? And so the likelihood of me saying, this is what I need you to do, is very, very low. Being intentional, us all taking an active role in supporting mamas, means being intentional and saying, hey, I'm going to come by next week and bring you some meals, or even start a meal train. That's something that's really popular now, right? Or I'm going to come over and do the laundry. Or if mama has other little ones in the household, let me watch all the kids for you. You know, those are like practical things each of us can do to support mamas that are either expecting or have or in the postpartum period. And that's something we all can do.
When Dr. Tom was talking, it made me think about a meme that said, okay, you want to do something, you want to come by, you want to see the baby, come see the baby at 3 a.m. That's when I need you to see the baby.
That's perfect.
Just thinking about things like that of mom and dad are tired, sleep deprived, coming in together. LeJeune talked about the meal trains. Also, what I've been seeing too is instead of the baby shower, they kind of do a nesting shower where family and friends come in and they put up the crib, the diaper genie, all these different things. They set up the house to put the diapers up, put the clothes up for mom and dad and the caregivers to make sure that when they get ready to deliver, they don't have to worry about doing any of that. It's already done for them.
That's
nice.
Excellent.
Yeah.
I guess, Dr. Tom, would be this one for you. You know, so no matter how many kids a mom has, whether it's their first or their fifth, they're all unique. Are they not?
Yes, that'd be accurate.
So it's one of those things, just because a mom has had 1 or 2 babies, she can say, oh, well, I got this, and I know how to get all this done, that you still, it's still different each time.
Sure, and the saying "comparison is the thief of joy" is apt in this moment, right? So you look at the way you interacted with your first baby and the way they slept through the night, and we sometimes call babies that sleep through the night trick babies, because then you're going to have another one, and that second one will get you, right? It's not going to sleep through the night, but you know, for moms in particular to compare their experience to what they think someone else's experience was, or what they think someone else's experience based on what they've seen on the internet or in some reel is really a recipe for misery. So, you know, that's it.
And in fact, you know, the risk for having a perinatal mental health condition actually increases with future pregnancies, especially when they're back-to-back pregnancies. Right. That increases your risk for developing a perinatal mental health condition. So to Dr. Recore's point, like, you think you got it under control. My first two didn't give me any problems, and then your third is like, and it can really have moms question reality, like really question themselves, right? Imposter syndrome and all the things. So, you know, again, that's why these conversations are so important, because now we're normalizing the conversation around, yes, each pregnancy is different. I was okay with the first two. Now I'm encountering some challenges. I know I'm not myself. What do I need to do?
Well, go ahead.
I was just thinking about going back to the dads. With the program Healthy Moms, Healthy Babies, and when I was in the field doing case management, the dads were the biggest supporters in regards to, they're going to tell you the truth. If mom ate right, if she didn't do this or didn't do that, because he's actually paying attention to her. We don't think about that. And sometimes as providers, we don't even ask the dad anything or even look at the dad when we're talking about how the pregnancy is going or how things are going after the baby's being born. So it's very important to include him, to know that he is, and whoever the partner may be, or even a grandparent or what have you, that they are listening. They're the eyes and ears. And you can also get a message to them as being, okay, these are the warning signs. Not only mental health warning signs, but also those physical warning signs that something is wrong.
Well, that's important when, you know, when moms go to the doctor, whether they're expecting or whether they've already given birth, that it's important to have somebody else in there with you, you know, to be supportive and to kind of listen to those questions that doctors are asking, because, you know, I know they ask those questions of, how are you feeling today? Have you felt depressed? And most of us roll our eyes and be like, I'm fine. I know. But somebody needs to be in there to speak some hard truth sometimes, right?
Sure. And sometimes we don't know that we're depressed, right? Sometimes we don't know that we're having a hard time. Sometimes we're just going through the motions, but those who love us the most and are around us can see that there is an issue. So to your point, just having that person, that advocate in there with you when you go to your prenatal appointments, or even when you go to your 6-week follow-up postpartum appointment is particularly helpful, because again, you know that gives them the opportunity to kind of speak up and say, these are the things I've noticed. I know you said no, but this is what it looks like to us, the folks around you who love you. And I wanted to do a shameless plug for the Maternal Mental Health Hotline, that national number, because for some family members, when mom isn't aware that she may be depressed or experiencing some mental health challenges in pregnancy or in the postpartum period, and family members around her see those things, sometimes they don't know what to do. And so there's a national maternal mental health hotline number. It's 1-833-TLC-MAMA, M-A-M-A. And that's a number that's for expecting and pregnant moms. Like, if they recognize within themselves, I need support, I need help, I don't know where to start, that number is a good starting place for them to call. It's 24 hours a day, 7 days a week. You can call, you can text that number. But also, it's a number for family members. Family members can call that number and say, I'm really concerned about my wife, or I'm really concerned about my niece, I'm really concerned about my sister, I don't know what to do, this is what I'm seeing, and they can offer guidance on next steps.
Dr. Tom, I think that it's important that when if they're scared to talk about it with the rest of their family, if anybody, you know, it's very important to be truthful with your doctor when they ask those questions, because it's a safe space, you know, and to not sugarcoat anything and to just tell them the truth, right?
That's exactly right. Yeah, there's one of the hardest things I think to do is to decouple the idea of you can be having a hard time and still be a great mom. right? That's what I think a lot of moms struggle with is, if I have a hard time, then therefore I'm not doing a great job. You can have a hard time and still do a great job. Most of the things I've ever done in my life that anyone ever said great job were really hard. And the same is true for parenting.
Well, it's one of those things that I know that you focused on a lot before, and you mentioned it earlier. Social media can be very dangerous to a expectant mom or a mom that just gave birth, right?
Sure.
I mean, I know you've got a lot to say when it comes to social media.
No. I mean, it is absolutely a predictor for me of someone having a bad time when I see them glued to their phone, hoping to gain some entertainment. All of these apps are designed to keep your attention at the expense of your mental health, and watching other people pretend to do well while you feel like you're struggling is just a recipe for misery. Is this what you guys see as well?
Social media is definitely, it's challenging, right? Because, we live in this new age, and certainly through social media, we're able to establish peer connections, which is great and wonderful. But I think also we get an illusion too of what motherhood is, what it should be. You don't get the beautiful shots of, like you talking about, 1 a.m., 3 a.m. in the morning with your newborn. Mind you, in my phone, I have to this day a video of me and my daughter up at 1 o'clock in the morning. I kid you not. And I'm just recording her like, we're just up. And I try to show it to her every now and then to this day. Just say, hey, listen. But yeah, those are the realities of motherhood. Motherhood is a spectrum. Parenthood is a spectrum. But I think we do get infiltrated with just the beautiful, the joys of motherhood, but not recognizing that too. Motherhood is also sometimes fear. Sometimes it's accompanied with uncertainty. It's all the things. And so, yes, I do think, we have to be mindful that of how much social media we consume, because, again, I think it can lead to us feeling guilt, shame, imposter syndrome, and all of those things.
It's so funny. I was telling Greg on the way in here at 1 o'clock. So yesterday afternoon, I got a plastic pool and put some warm water in it and some cool water, and had my 2-year-old swam. And we took a bunch of pictures of that and shared them with family. And then at 1 o'clock in the morning, unrelated to the swimming, I think, he woke up and vomited on me. So we were giving him a bath, and I would just, it's fine. When it's your own child's vomit, it's fine. But we didn't share any pictures of him vomiting on me, or
just the nice,
him crying in the tub, right? And so to anyone else who's looking, like, man, well, how fun is it to have a 2-year-old? Well, it's fun. I'm happy in every moment, and sometimes I'm in other person's vomit on me, right? So
absolutely,
I'll play devil's advocate a little bit. Social media also has positive points to it. I have seen to where moms are coming out speaking more in regards to the rough times and not all the glory moments or what have you. Or, hey, this is what it looks like in 3 o'clock in the morning, my hair a mess, and I'm breastfeeding. Or all those different things. And just being there as a support, knowing that other people are out there who are struggling, who are trying to do good just like you are, just trying to be the best that they can be, we see that they're out there. So it is a connector as well. We do have to be careful with some misinformation or misguided information in regards, of course, of how we take care of ourselves and take care of our families.
Well, I think it'd be great. You get back, look on your timeline and share it with other people. It'll be funny to you 20 years from now when you take that picture being covered in throw up, and then, the diaper blowout, at 3 a.m. You look at it, and I think that would actually do more to help other moms.
For sure.
Than the cute pictures with the Easter bunny or things like that, because they're like, ooh, Yep, I can relate to that. I'm covered in this, and it's everywhere. What am I going to do? So totally. I think that's important.
It is. It certainly is. I mean, our stories connect us. I'm a firm believer in that. But, like, the spectrum of our stories, right? Like, not just the good, but the challenging, the difficult moments, all of those things matter. So yeah, I just think, like, to Jillian's point, Dr. Recore's point, social media can be a great connector, but on the other side, it can also have us question ourselves to a certain degree. And so just being mindful of the consumption, what we are consuming, is really, really important as well.
Well, and this definitely goes to the, we take care of mom, we take care of baby, right? So the healthier mom is, the greater the chance we're going to get that baby to its first birthday, as Dr. Edney always likes to say, right?
Yes.
Absolutely.
That's right.
Yeah.
And to, when we're talking about these challenging times too, there's this idea when you're trying to affect change that perfect is the enemy of the good. And then, I guess a corollary to that would be that good can be the enemy to good enough. And so when you think about what moms, before maybe being a mom, you might like to have a really clean house all the time, and you might like to entertain guests, and now you have more guests coming over that really may or may not be offering support. So for moms to know that good enough is really the aim, getting good enough sleep, taking good enough care of yourself, maybe letting go of the idea that you need to be back in action as productive as you previously were within 2 weeks. Maybe all of these things can be harmful, and aiming for good enough is worthy of praise.
Dr. Tom is exactly right. I can think about when my now 2-year-old was born, and I wanted to do everything that I was doing before, plus take care of this beautiful baby, and I was burning myself out. And nobody speaks to those things. Are like, you know what, you're going to have to let something go. You have to let something go, and you got to put your priorities in order. And sometimes we have to have those conversations with ourselves. And just going back to the house, again, I had my house decorated and, like the magazines or whatever like that. And now with the 2-year-old boy, it's like, this is his house. Like,
I love it.
I have let
Absolutely.
him have it, whatever. As many times we try to clean up, it's like he intentionally looks at us and like, oh, you really going to do that?
Knock it over.
Pours
Knock
it
it over.
right out. So you just have to be patient with yourself, be patient with the process. That it's not going to last always, but you're going to miss those moments to where they did do these things, or you experienced that, and see how far you've come.
Yeah, it's okay to have a dirty house. When the people aren't going to hold it against you. It's okay that toys can be everywhere. It's okay that clothes can be everywhere.
You have to just keep telling yourself that over and over.
That's
It's
right.
Okay, it's okay. It's okay.
So you don't feel inadequate, I guess, is the best way to put that. One other topic I wanted to hit real quick is because we have so many socioeconomic factors in play in this day and age right now, with cost of living, and it can feel overwhelming, for parents, a mom especially, to want to make sure that they're doing enough, for their baby. And it's, Jillian, I think you said it, it's like, I got to let some things go. Because these are some very trying times that can weigh on your mental health.
It actually can drive it to where you do develop these mental health disorders or mental health conditions, just with the barriers, the things that we face. Just in Mississippi, someone would tell me that every mom in Mississippi is high risk because of the factors of what we have going on in this state. So we have to think about that. Like you said, food prices are rising, gas is rising, child care is rising, just all these different things that are going on around. And it's like, I have to do enough to take care of my child, to take care of my family. And that weighs in on mama as far as, again, that superwoman complex, that we have to do it all, that, we don't want to bother anybody by asking for help. And then it's like, well, the next person is struggling too, so how am I going to ask them for help as well? So all those things do take a factor into not only our mental health, but our physical health as well. It can weigh down on us. And that, in tune, can affect, again, that pregnancy. So we're not only talking about postpartum, but we're talking about mom in her pregnancy dealing with mental health conditions. So where baby can be low birth weight, stillbirth, preterm birth, just things like that, because when mom is dealing with all the stresses of the world, she's not taking really good care of herself, which means that baby can end up not being taken care of as well.
Dr. Tom, all those socioeconomic factors can pile up, can't they?
Yeah, for sure, and they can feel all-consuming, and I think the ways we get stressed out, I think a lot about resilience and grit, and having a baby and experiencing these hormonal changes for sure will deplete your resilience. So sleep deprivation, anxiety, financial stress, all of these things can be really challenging. And so, I think what we're talking about some today is how to improve the quality of your mind. And I've heard both of these ladies also say self-care in the way we're describing it for moms is not self-indulgence. Self-care is necessary, even if your intention is to be the best mom you can possibly be. The way to do that is by taking care of yourself, getting enough sleep, taking care of your mental health. If what you want to do is be good for your baby and make sure your baby is cared for, then the self-care really is paramount in any formula by which you're taking care of those people that you're entrusted to care for.
June, I think one of the things that moms need to realize, there are resources out there to help you, and you don't have to make a big deal about it.
Absolutely.
There are things there that you can privately do on your own and keep it close to your vest, but it's ultimately going to help you with those resources.
Absolutely. And underscore that there is help, there is support, there are people who care about you, that want to see you well. Something I highly encourage is moms, if we are encountering maternal stress, you talked about socioeconomic stress. Absolutely. That's something we all can identify with on some level. So if you are encountering maternal stress or economic stress or, other factors that have you feeling down, talking to your provider about some of these things may offer the opportunity to get you connected with a social worker. And the social worker can look into getting you connected to resources like, WIC or Medicaid or economic assistance, TANF, all of these programs to help support you in your pregnancy and in your postpartum period. There are so many programs that will help support getting you a car seat, help getting you a baby crib for your baby. And we all know car seats and baby cribs are very, very expensive. So, these are some of the things that we can take off of your plate so you can focus those energies on other things. So I always highly encourage our mamas to talk to someone, talk to a trusted provider, talk to a social worker, a case manager, express these concerns to someone in your circle that you trust that can help start in motion getting you connected to the kind of resources and services that you need.
It's just taking that first step, whether it's, you contact Healthy Moms, Healthy Babies, and all the things that the health department can point you towards, as you mentioned, WIC, one of them, the cribs, car seats, all of those things that can really take a weight off of a mom's shoulders if she knows that it's there. But then also, I guess it's harder to get him to call the mental health crisis line. In your experience, do you think that that's hard for them to do?
Sometimes it is, because we still have to think about, we haven't talked about the stigma of mental health, not just even talking about pregnancy or postpartum or what have you, but just the thought of, is something wrong with me? And what are people going to say? I'm not crazy, or just different things like that. So I think with programs like Healthy Moms, Healthy Babies, some of the others at the health department, a lot that we have in the community, that to empower them, to let them know, the families know that, we're here to help you. Speak up when there's concern, whether it be about your body, whether it be about your mental health or your baby or whatever it is, that it's okay to seek help, that it's okay sometimes to not be okay. And I think we need to normalize that, that we're not always okay. And I think once we knock down those barriers of it's okay not to be okay and that help is out there, then we can start seeing some changes and that number being utilized more.
I think that's exactly what the Department of Mental Health has been trying to do, is to put this out there and be like, it's okay to not be okay, but get help, right?
That's perfect. And it sounds, I wasn't even aware of this number for moms, and you've got 988 for emergencies, but I would also just say, rather than waiting for crisis, take care of the mental health issues early on. Pursue good sleep. Pursue getting the things that you need taken care of. If you think you may be depressed, or you think you may be too anxious, and that sort of you've gone to the dysfunction level of the anxiety curve, there are medicines that have been shown to be safe even for breastfeeding mothers, that can help with sleep, that can help with depression, all of these things. So it's absolutely worth a conversation early rather than even waiting for a crisis to emerge.
Well, some of the numbers, June, you had mentioned it before, for the National Maternal Mental Health Hotline is 1-833-TLC-MAMA. The Postpartum Support International Helpline is 1-800-944-4773. Because I think a lot of times they just want somebody to listen. You know, a lot of times half the battle is telling your story to somebody, and then they're like, it's okay. It's normal. Mm-hmm. It's normal to think that way. And it's amazing how people will take a big, deep breath at that point and be like, they understand. And it's just having that shoulder to lean on, right?
Absolutely. Listen without judgment.
Mm-hmm.
You know, a lot of times, you know, when mamas are navigating some challenges or struggles, you mentioned this earlier, you know, back in the day, mamas, they got a commemorative T-shirt because they have survived. And sometimes we think we're being helpful when we say, well, when I went through this, you know, I XYZ. Well, I don't feel that way, and I'm having a harder I feel like I'm having a harder time, and sometimes that can trigger inadequacies within ourselves when our friends or family members tell us, well, I went through the same thing, and you'll be all right, I survived. You know, we can't be dismissive in that way. You know, just listening without judgment, just listening to listen, allowing them to vent, get it off their chest is, again, something that we all can do. It's something I say it's practical that we all can do, is just listen without judgment. And sometimes even when we're listening, we're thinking of ways, okay, how can I support her? How can I help her? It's okay that you don't know. That's why we gave the number. You know, you don't know where to start? Call the number. Yeah. They'll offer next steps that kind of guide you on how you can further support her. But yeah, listening without judgment, I think, is something that we all can do.
Yeah, listen without preaching before you give your response, right? Yes. Don't preach it.
Yes.
Listen, and then point them in the right direction to that number, to that agency, to that organization, so we can start getting them some help. Well, folks, this was fascinating. I can't thank you guys enough, because I think that it is important to shine a spotlight, certainly on maternal mental health, but mental health in general. Yes. Because once we get over that hump, I think we're going to have a much healthier Mississippi. Jillian Harper, LeJeune Johnson, Dr. Thomas Recore, thank you guys so much for coming in.
Thank you,
Greg.
All right, that's going to do it for the May edition of Health Talk Mississippi. Remember, mental health is as important as your physical health, so don't be scared to reach out. Until next time, I'm Greg Flinn, and this is Health Talk Mississippi.